Welcome to Health Drops, monthly video clips for your well-being. My name is Marisia Jiménez. I'm a naturopath, and I have founded Asclepios, the wellness and healing retreat of Costa Rica. Asclepios has been born to contribute to human health regardless of age, gender, origin, or beliefs. Today we begin a series of video clips to help identify the depressive syndrome, a disease of our times, and lately we will explore ideas to prevent it and control it by natural means. Depression is a frequent syndrome in daily practice. Out of 10 patients who come to the office of the general practitioner, one suffers from depression. Depression is also responsible of an important part of the suffering, disability, and impaired quality of life of people. In natural medicine, we distinguish between two types of depression: endogenous depression and exogenous depression. The term endogenous is used to refer to something that is caused internally, as opposed to exogenous, which refers to something that is the result of external causes. The endogenous depression might be catalogued as a psychosis, for showing a real melancholy without identified cause. Such depression characterizes by the following aspects: vague feelings with a relative emotional anesthesia, suicidal ideation, self-disgust, disgust of life, memory, concentration, cognition, and communication impoverished, almost no request, unable to speak about his/her emotions, family history of psychical disturbances, suicide, alcohol. This depression is quite severe, and it has been traditionally excluded of treatment in natural medicine. The other type of depression is the so-called exogenous depression, that might be catalogued as a depressive neurosis, and that is the result of a conflict due to exterior causes: a loss, inadequate social support, stressful life events, coexisting illness, drug intoxication or withdrawal, but the person is still able to speak about his or her emotions, even though there is a clear loss of the vital impulse, of the joy of living, loss of confidence and self-esteem, feelings of guilt and abandonment, excessive blame, apathy, and pessimism. The population at risk is multiple: elders, teenagers, alcoholics, retired or unemployed individuals, misfits. Look for somatic symptoms like sleep disturbances or sleep shelter, appetite and digestive disturbances, problems of the libido or loss of sexual interest, exhaustion, anxiety, diffuse pain, and cardiac oppression. There are 3 risks: suicide, chronicity, and bipolarity. Depression can also be masked under other systems such as gastritis, colitis, and back pain. What originates depression? There are many theories. It can be a physical cause, which is a deficit of chemical mediators in the brain, or the inability of these neurotransmitters to cross the cell membrane, which generates an ionic or electrolytic imbalance. There are psychic causes, like the loss of the object of love, or cognitive, when someone invests in wrong beliefs or negative patterns of thinking. According to the orthodox naturopathic theory, Some other causes of depression were the following: chronic indigestion, physical or intellectual surmenage, psychological surmenage, repeated conflicts that produce wear of the nervous and endocrine systems, sexual overwork, exhaustion of the energy of the kidney, and chronic contractures which burn a lot of energy. How to treat depression? The first thing to do is to prevent it having a healthy lifestyle and a positive attitude towards life. We will discuss all the possible natural solutions in our next video clips of health drops. For now, I leave you with some important tips. Be positive. Enjoy every moment. Focus on the significant and happy life events. Count your blessings. Always have the best attitude. Be aware that all experience is an opportunity for growth and learning. Get used to thank life. The problems are clouds, and behind them the sky is always blue. Remember, reality is only what happens. We are who choose how to label it. Take time to grasp the moment and smell the roses.